Okay, let's talk about what's causing your hair loss. Well, if you're like 99.8% of men, your hair loss is caused by androgenic alopecia. That's hormone-related hair loss or male pattern balding. That's when areas of your scalp, maybe the temples or the front hairline or the crown, are actually losing hair, whereas the sides and the back are staying relatively stable. Now, if you have different types of hair loss where it's diffuse or it's patchy, you may be in that small percentage of people who has non-androgenic alopecia. But in androgenic alopecia, this is what's going on. Testosterone circulating your body, usually at normal levels. Usually there's no issue with testosterone being too high. It's not a common thing in males. Testosterone is converting into dihydrotestosterone, DHT. That's a big buzzword online. If you go read about it, there's a lot of DHT blocking agents out there to protect against hair loss. Well, once DHT is circulating your system now, it binds to hair follicles with DHT receptors. Not all hairs have DHT receptors. The ones that do, you guessed it, are the ones in the areas where you have the patterned hair loss. Either in the temples, the front hairline, the crown, but there are no DHT receptors, or there's a very low density of DHT receptors on the sides and the back. Once DHT binds to your hairs, it actually causes a change in gene expression that drops the metabolism of the hair down. What happens when the metabolism of the hair goes down? Number one, the hair gets thinner, progressively thinner over time. The hair is not falling out. That's why you're not seeing a lot of shedding. You're seeing progressive thinning of the hair. If you're seeing shedding, there's probably a second component of hair loss going on or something different to that. The second thing, the hair is losing color density. You'll know if you look at the depth of the browns or the blondes in the areas in your hair, they're a little bit lighter and duller in the areas where you have hair loss as well, because that's because the color density is dropping. Now, importantly, the body is going to respond to this decrease in metabolism. So now those hairs are using less energy, they need less blood flow, and the body's pretty smart. It's going to drop off the blood supply to those hairs. And then when that blood supply drops off, that hair is never going to be able to grow thicker than that blood supply allows. And that's the end all be all, is what is the status of that blood vessel and what's the status of that follicle. So in treating hormonal hair loss from a medical standpoint, we want to block DHT. We want to increase the metabolism of the hairs. We want to increase blood flow. And a quick example, Rogaine is just a blood pressure medication for the scalp. You put it on topically, it keeps the blood vessels open. It is keeping the blood flow to the hairs there longer, but it's not preventing hair loss. So you have people coming off Rogaine and the loss continues. And that's because all they did was increase the blood flow. Now, once a hair reaches half its original width, is one of the critical points that a lot of researchers look at. Once it gets below half its original width, it's really hard to restore the blood supply or rejuvenate that follicle enough that the hair will regrow. It's just not going to happen. But if the hair is half its original width or more, it usually means that there's enough blood supply, enough kind of leftover capability in the hair follicle that you may be able to restore the hair follicle using medical therapies. And that's the big separation between medical hair restoration or rejuvenation and surgical hair replacement or transplantation. So that's what's going on with your hairs. Unless you're a rare case in men, women do have multiple reasons for hair loss, but in men, most likely it's related to androgenic alopecia, and it's happening just like we discussed.